Hello all, today we are going to see about mental retardation. Before that, myself C.Anjal, working as an assistant professor, MSc Nursing, ES College of Nursing. Let's start the topic. Introduction of mental retardation. Mental retardation, it is a worldwide problem. Mental retardation is the one of the most chronic neurological disability of the childhood. It is affect 1 to 3% of the population, but this term never be used in pediatric. Why means the parent and caregivers take serious about this condition. This term is having a stigma and affect our treatment. They are thinking like, my children having a big problem, so we should not use this terminology nowadays. And also people are start thinking in different angle. So mental retardation term is discovered in replaced by intellectual disability presently, but majority of cases are idiopathic. Mental retardation is defined as significantly sub-average general intellectual functioning and impairment in cognitive and adaptive functioning. Let's move on to intellectual disability. Intellectual disability, also known as general learning disability and mental retardation, is a generalized neurodevelopmental disorder characterized by significant impairment in intelligence and adaptive behavior. Here, intelligence includes the ability to learn, reason, problem solving and other skills. Adaptive behavior, the person having including the everyday social and life skill. And next, move on to general intellectual functioning, which means it is defined as a result obtained by the administration of standardized general intelligence tests developed for the purpose and adapted to the condition of the region and country. The definition of mental retardation. Mental retardation refers to significantly sub-average general intellectual functioning. It's resulting in or associated with concurrent impairment in adaptive behavior and manifested during the developmental period. In this definition, sub-average of general intellectual functioning, this meaning of the person affected below average of or sub-average of the intellectual scoring 70. So we called as a sub-average general intellectual functioning. How to calculate the intellectual functioning means some intellectual test are there. According to that, we will calculate the score of IQ, which means intellectual quotient. Next, this definition given by American Association of Mental Deficiency in the year of 1983. Next, move on to the classification. The classification of mental retardation, mild classification, IQ level is 50 to 70% and moderate level is 30 to 50% of IQ level. The severe 20 to 35% IQ level. Performed retardation is below 20. Next, what is IQ? IQ is the intelligence quotient. How to calculate means it is having a formula. Mental age. How to calculate this means so many intelligence tests are there. According to that, we calculate mental age. And chronological age means the person actual age of development. This mental age divided by chronological age, these two are multiplied 100. Then only we will get the score of intellectual quotient. According to that, we classified mild, moderate, severe and performed. Next, move on to classification of the mental retardation. How the person will get a difference of behavior and disabilities of patient. This is a commonest type of mental retardation according to the mild retardation, 50 to 70% of IQ level. They are all presenting in 90 to 85% to 95% of causes. Those individuals have minimum retardation in sensory motor area. Moderate retardation, 30 to 50%, already we seen. About this classification of individual, 10% of mentally retarded came under this group. Next, severe retardation is often recognized early in life with poor motor development and absence or markedly delayed speech communication skills. Profound retardation, these groups accounts for 1 to 2% of all mentally retarded. The achievement of development milestone is markedly delayed. They require constant nursing care and supervision. Next, deficit in adaptive behavior may be reflected in following areas of according to the age group. During the infance and childhood, sensory and motor skill development. Next, communication skill including speech and language, self-care skill development, socialization. During this ages, the person will develop this motor and sensory development, and during childhood and adolescence the people will develop application of basic academic skill to delay life activity. We should assess during this ages. Application of appropriate reasoning and judgment in the mastery of environment, social skill. Next, during late adolescence, the person should develop vocational and social responsibility and performing, and developmental period is defined as the period of time between conception and the 18th month of the birth. And next we are going to see about the epidemiology of the mental retardation or intellectual disability. The overall intellectual disability in India standardized. Some studies are given this epidemiology. 10 to 5% urban area, 10 to 5% of person will affected, and urban population has a slightly higher rate, 11% overall 1000 population. Then rural populations are affected, 10.8% individual are mostly affected according to overall 1000 population. Next, etiological factors of intellectual disability. And in most of cases that exact causes is unknown. The condition developed due to injury, disease or certain brain conditions. First, we will see the genetic factors. It is the most common etiological factor seen in some cases. First, chromosomal abnormalities like Down syndrome, Fragile X syndrome, Trisomy X syndrome, Turner syndrome, Characterized syndrome, Prader-Willi syndrome. This all comes under the chromosomal disability. Next, metabolic disorders. It may cause the intellectual disability. For example, phenylketonuria, Wilson disease, cranial malformation, hydrocephaly and microcephaly. It is also will cause the intellectual disability. Gross disease of brain. The gross disease of the brain, it is also cause the intellectual disability. Tuberous sclerosis, neurofibromatosis, epilepsy. And then the second etiological factor is prenatal factors. Prenatal means during the antenatal, before the birth of the baby, we call as the prenatal period. In this period, the mother will get chance to infection like rubella, cytomegalovirus, syphilis, toxoplasmosis, herpes simplex. So it will cause a mental retardation. Next, endocrine disorders. During this antenatal period, the mother will get hypothyroidism, hypoparathyroidism, diabetes mellitus, it is also mainly cause the intellectual disability. Physical damage and disorders, for example of injury, hypoxia, radiation, hypertension, anemia, and also emphysema. It is also the mainly affected the mother and also the baby. Intoxication, for example of lead, certain drugs, substance abuse. Those are all the comes under the prenatal risk factor of mental retardation. Placental dysfunction, toxemia of pregnancy, placenta previa, cord prolapse, nutrition, growth retardation. Next we are going to see about the perinatal factors. Perinatal factor means during the labor period, we call as a perinatal perinatal factors like birth asphyxia, prolonged or difficulty in birth during the labor, prematurity, and these are all the affected the person. Next, postnatal factors. Postnatal factors after the delivery of the woman called as a postnatal. So during the time the mother will or child will get infection in encephalitis, measles, meningitis, septicemia. Accidents, lead poisoning also will affect the person, baby. The fifth factor is environmental or social cultural factor. Cultural deprivation, low socio-economic status, inadequate caretakers, child abuse. Next, we will see the clinical manifestation of intellectual disability. First, we see the difficulty performing self-esteem of the individual, irritability when frustrated or upset. The individual having a depression of mood, psychomotor skill deficit, and the individual having a acting out behavior, persistent of infantile behavior, lack of curiosity. Next, we see the diagnostic evaluation of the intellectual disability. First, we should collect the complete history collection from the parent and caretakers. Next, we assess the patient physical examination and mental status examination of the individual. Neurological examination, assessing the milestone development of the individual. Investigation like urine, blood examination for metabolic disorder. Culture for the cytogenic biochemical status. Aminosynthesis in infant chromosomal disorder presenting or not, it was helping for the during that time. Next, chorionic village sampling. We should assess hearing and speech evaluation of the individual. And EEG, electroencephalogram, is helping for seizure patient. And also we should do the CT and MRI. Next, thyroid function test. Next, psychological tests like Stanford Binet intelligence scale, and also we will assess the Wilshire intelligence scale for the children for categorizing the level of children disability. Next, the treatment modalities of intellectual disability or mental retardation. First, environmental supervision. That we should assess complete supervision of the intellectual disability parent or and take care caregivers. Behavioral management. Third one is monitoring the child developmental needs and problems, and we should programming that minimizing speech, language, cognitive, psychomotor, social, self-care, and also the emotional, occupational skill. Next, ongoing evaluation for overlapping psychiatric disorders such as depression, bipolar disorder, attention deficit hyperactive disorder. Family therapy, it will help for parent developing coping skill and deals with guilt or anger. Early intervention program for children younger than 3 with intellectual or mental retardation. Providing day school to train the children in basic skills such as bathing. No specific drug available, antipsychotic drug, neuroleptic drugs to reduce the aggressive behavior and antisocial behavior. For the example of phenothiazine, antidepressant drugs therapy also we will administer. Next, we will see the nursing diagnosis. It will helping for during the theory examination and clinical examination. The first nursing diagnosis, self-care deficit related to altered physical mobility or lack of maturity. Second diagnosis, nursing diagnosis, impaired verbal communication related to developmental alteration. Third nursing diagnosis, impaired social interaction related to speech deficiency or difficulty to conventional social behavior. Fourth one is anxiety related to hospitalization and absence of familiar surrounding. Fifth one is activity intolerance related to fatigue, general ability and discomfort. These 5 are nursing diagnosis for mental retardation or intellectual functioning. Next, prevention of intellectual functioning or mental retardation. There are 3 types of prevention: primary prevention and secondary prevention and tertiary prevention. These steps the nurse should follow. Primary prevention, providing in socio-economic condition, education to remove the misconception of the condition and medical measure for the good prenatal medical care, universal immunization of children, facilitating the research activity to study the care of mental retardation, genetic counseling for the risk parents. So, we should avoid the consanguineous marriage. Next, secondary prevention, yearly detection and treatment of preventable disorder, yearly detection of handicaps in sensory motor or behavioral areas with yearly remedial measure treatment, yearly treatment of infection, yearly recognition of presence of mental retardation. Tertiary prevention, we should follow adequate treatment of psychological and behavioral problems, behavioral modification using the principles of past and negative reinforcement, rehabilitation in vocational, physical and social areas, and last one is perinatal counseling. Thank you for watching this video. Please subscribe and share the video. Thank you.